what is the difference between Cialis and Viagra? And I've seen some advertisements from telehealth companies where they're now mixing those together. What are your thoughts on that?
Mixing them together is just really, I think, a gimmick. The difference between the drugs is that tadalafil, the generic Cialis, takes longer to kick in and it lasts much, much longer. So
Okay.
It takes between 1 to 2 hours to kick in, and it stays in your system for up to 36 hours. So they used to call it the weekender. You take a pill on Friday, you're good not just Friday, but Saturday and maybe a little bit of Sunday. But the thing is, you're going to get the peak benefit between 1 to 2 hours. So that's why you really still want to try to time it. Now, some guys take a lower dose of the daily tadalafil every day.
Mm-hmm.
That's mainly meant as a pill to help with urinary symptoms due to prostate enlargement.
Mm-hmm.
I usually tell guys who are struggling with ED, particularly if it's pretty severe, you want to take the full strength an hour or two before. That's going to give you the most bang for your buck. If you have a very mild case, just taking that one little 5 milligram dose once a day may be all you need. But if the longer time that passes from when you take it till you're trying to use it, meaning trying to be intimate, it's going to slowly be wearing off after 2 hours. The other thing, so Viagra, also generic sildenafil, kicks in quicker, 30 to 60 minutes, but it wears off quicker. So after like 60 minutes, it's already starting to wear off. And within a couple hours, it'll be like totally gone. Side effects are pretty similar. The sildenafil gives a little bit more, well, it definitely gives more vision stuff, like bluish changes to your vision, more stuffy nose, congestion, flushing kind of thing. The tadalafil is probably still a little bit of that, less of the vision stuff, maybe a little bit more heartburn or ache in the back with the tadalafil. Heartburn's pretty common, and those side effects tend to go away after using it for a couple of weeks. Anyhow, so the sildenafil, generic Viagra, if you take it with a big meal, it doesn't work. So you should really be taken on an empty stomach. Whereas the Cialis/tadalafil, that one doesn't matter if you take it with food or not. So 95% of the prescriptions I write routinely are for tadalafil. I think takes things out of the equation. You don't have to worry about the food. It's just a little more forgiving. And guys are pretty happy with that. But if you take a full strength tadalafil, it's just about as equal, it's about equal to all the other drugs that are available for ED. So you don't necessarily have to feel like you have to keep trying all the different ones. I mean, some guys like one versus the other, mainly for side effects. But if you take a full tadalafil and you wait an hour or two and you try, you got to get aroused and stimulated and all that. You can't just sit there staring at a wall and wait for something to happen. But probably pills are not going to give you the response you're looking for if that full strength tadalafil doesn't work. Okay, so don't waste your money getting these multi-$100 variants and mix with this and mix with that. I mean, we're talking minimal differences, if any. If the pills aren't working, that's when you need to talk to a urologist. There's all sorts of other stuff out there. We've got this shockwave therapy now. It can be used to try to give a little bit of a boost, and it's got to be the right patient for it. There's vacuum erection devices, penile injections, penile implants, etc.